Hey guys, welcome to my YouTube channel. This is Jay Patel and I am a certified physician assistant here at MyFitMed. Here I cover multiple topics to improve your overall health and fitness, and the topics may include hormones, vitamins, weight loss, and overall lifestyle changes. The goal is not to treat you but to educate you to help you get in the best shape of your life. Enjoy the video. Today I'll talk about 4 thyroid myths. Myth 1. T4 is good and T3 is bad. T3 is the molecule present from birth in every human body. T3 is the active form of thyroid, and T3 actually improves the symptoms of low thyroid. No studies has shown that T3 damages your heart, brain or any other tissue. Myth 2. T3 will cause atrophy of thyroid gland. No studies has shown that it damages the previously healthy gland to prevent normal functioning when the medication is discontinued. So T3 doesn't actually damage the thyroid gland. Myth 3. Suppressing TSH will cause osteoporosis or bone loss. Hyperthyroid or Graves' disease, where your body produces too much endogenous thyroid hormone 24/7, is linked to bone loss. Now that doesn't mean that when you take the external thyroid hormone once a day will damage your bone loss. So no studies has shown that optimizing the T3 close to the upper limit are linked to bone loss. Myth 4. Once you start thyroid, you will need it for the rest of your life. This statement is only true if you have had a partial or a full thyroid removed. Thanks for watching. Hope you learned something about optimizing your overall health. Talk to your medical provider before starting any treatment. Let us know what other topics you want me to cover. Give us a thumbs up if you like the video and subscribe for more videos.